That summer I went back to Cape Town, eager to interview Health Minister Manto Tshabalala-Msimang for the treatment of HIV patients and the overhaul of the pharmaceutical industry in South Africa for the Irish Medical Times. I was particularly annoyed that the new ANC government, under the tenure of the second post-apartheid president of South Africa, Thabo Mbeki, questioned the link between HIV and AIDS and believed that the correlation between poverty and the AIDS rate in Africa was a challenge to the viral theory of AIDS. The article would focus on the willingness of the South African government, under the stewardship of Mbeki, to allow the pseudoscience of Peter Duisberg to masquerade as science. I wanted the health minister to explain to me why she had decided to reject the use of AZT in all ANC-run provinces, even though the manufacturer was willing to cut the price of the drug. This was a ridiculous position, as the number of people in South Africa with HIV was now nearing 5 million. And it was evident to one and all that the drug was the only means of preventing the spread of the disease in newborns. Thankfully, the doctors in the Western Cape were not under ANC control and went ahead with providing the drug despite pressure from these people. While in Cape Town, I was invited to a bar on the waterfront for a social function that was attended by some senior ANC government officials. At first, everything was excellent, and the conversation centred on the political direction of the new South Africa. We chatted about how they should address the significant social problems of housing and poverty. As the drinks flowed, I expressed my opinion that President Thabo Mbeki's belief that AIDS was caused by poverty, not HIV, was not based on science. It was lunacy to assume that the communist health minister's approved diet of beetroots and ginger could save their people from decimation. The truth didn't go down well intellectually or socially. In their eyes, I had crossed the line. The officials refused to talk any longer and eventually asked the staff to remove me from the bar. What irony! 6 years earlier, I had been asked to leave the bar in Cape Town because I had stood up for some poor blacks who had been refused a drink because of apartheid and white racial prejudice. Now I was being ejected from another bar in the same city because I had stood up for them against their own new leader's scientific ignorance. As I walked past the homeless children openly sleeping along the dirty pavements of Long Street, I stood for a while and looked over at the hostel where I once lay my head. As I stood there, I thought that the emperor might have changed his clothes in South Africa. But when it came to the future health of the nation, it certainly hadn't done so for the better. Incensed about what was happening, I wrote a strongly worded article for the Irish Medical Times on my return to Dublin, entitled, "A Tragedy That Has Resulted in Countless Needless Deaths in Africa." This article made me persona non grata with Mbeki's regime for a period, and it was cast back to me by some government officials when I visited Cape Town again a few years later. Their ban on antiretroviral drugs in public hospitals has since been estimated to be responsible for the premature deaths of between 330,000 and 365,000 people. This apparent inability of some members of the ANC to respect Western science again featured a few times in later years in South Africa, but none more prominently than in late September 2015. It took me longer than most to discover that its origins were deeply embedded in the culture of a people whose psyche was deeply traumatized by years of colonial oppression. The incident to which I refer happened when I was lecturing at the Cosmetica Conference 2015 in Johannesburg. A controversy had been brewing